Slit disc, diagnosis and treatment.
Typically, slip disc is diagnosed through what the patient's symptoms are. A simple examination will help us identify where the potential areas of damage is. An MRI is an essential tool for diagnosis. An MRI is a gold standard to diagnose slip discs. An MRI shows us good detail of disc anatomy, if there's any pathology in the disc, if there's any impingement of the nerve root. So an MRI will typically show us whether there is presence or absence of slip disc. So that's essentially how slip disc is typically diagnosed. Now, treatment depends on the symptoms. Not every slip disc requires surgery. So if the condition that the patient presents with is only pain, then treatment is directed towards relieving that pain. I usually start my patients on physiotherapy for at least a month, 1 or 2 sessions a week, with a bit of oral analgesia to help with the pain. Usually, more than 50% of patients experience good pain relief with these two measures. Physiotherapy and analgesia relieves their pain quite significantly. If physiotherapy and analgesia do not help with their pain relief, then I would consider doing what is known as radiofrequency ablation or radiofrequency modulation. Now, radiofrequency modulation is a technique where we target the source of the pain. Most of the time, the pain comes from the joints. The small little nerves at the joints, which results in the patient experiencing the pain that they have. Radiofrequency modulation means that I target these nerves on the joint. I change how the nerve responds to pain for a short period of time. It is not curative. It doesn't cure the condition, but it relieves pain. So it's essentially a pain relief procedure where these nerves that cause the pain are numbed using fine, small electrical stimulation, and that gives pain relief for a period of time. However, if patients present with pain and numbness or weakness, and the MRI shows that the amount of slip disc is significant, it is compressing a spinal cord, then I may have to do something more than just physiotherapy or oral medications or radiofrequency ablations. This is when surgery comes in. And surgery is aimed towards protecting and saving the nerve.